So our preload and our afterload. Our preload is created by the blood volume in the left ventricle at the end of diastole. So when we think of our blood pressure systolic versus diastolic, what is systolic? The compression of the left ventricle. So diastole is what? When it's relaxing, right? So when that heart is relaxing, when that left ventricle is relaxing, the preload is the filling of that left ventricle at rest, versus the afterload is the resistance in the aorta overcome by the contraction of the left ventricle. So the way that I like remembering preload and afterload is, say I have this reservoir that I'm pushing fluid through a straw, okay? This reservoir is being filled with fluid. That is my preload. The preload is what's filling my left ventricle. And then as I compress my pump and push out that fluid, that is my afterload. So I have the fluid coming into the heart versus the fluid that's being pushed out of the heart. Preload is the fill, afterload is the push. So we have something called Frank-Starling's law of the heart. So this has to do with our preloads and our afterloads. The idea is the bigger the stretch, the bigger the push. Okay, so if I have a rubber band and I'm shooting it across the room, say I'm shooting it as Azael, if I pull this rubber band, the further I pull it, the what happens to the rubber band? The further it goes, right? So with that bigger the stretch, the bigger the throw. The larger my rubber band, the larger the shot. The more my ventricle is able to contract, the more force it can create to push out. But there is a limitation to how much this can stretch, right? So if I pull a rubber band too far, what happens to that rubber band? It snaps, okay? Now, in theory, our heart shouldn't snap, but it can only stretch so much and only push so much. But the more contractile force, the more force I can create in that ventricle, the bigger the stretch that I can create, the much more blood that I can push out that afterload. As a disclaimer, Frank-Starling's law, I don't believe is in your EMT book. This is just good information to know about physiology of the heart. Fact check. Is it in there? Oh. It's in there, so you have to know this. This is curriculum. What? Drugs. Meth is a hell of a drug. It'll explode your heart. Not explode your heart. I'm sure there is. We can find it. Hey Siri, what can explode your heart? Meth. Jack in the Box. Yeah, that'll explode your pants. So our systemic vascular resistance. So we remember on our lung side how we have that airway resistance, right? We have resistance, which is that constriction, and that compliance, which is that opening. We also have something called systemic vascular resistance, which is our SVR. With our systemic vascular resistance, this is when my vessels will vasoconstrict or vasodilate. So if we go back to that anatomy and physiology, what part of my brain is controlling that vasoconstriction, vasodilation? Brainstem, right? You guys know it, say it, right? So that caveman brain, that brainstem, right? That vasomotor factor. So if we are playing with the brainstem, our nervous system, that sympathetic, parasympathetic nervous system, right? What is my sympathetic nervous system? My fight or flight causes vasoconstriction or vasodilation? Constriction, right? So my parasympathetic nervous system, my feed and breathe, my rest digest causes what? Dilation, right? So as my body's trying to find this homeostasis, this happy place to be with my blood pressure and my pulse, I'm constantly having these impulses of vasoconstriction, vasodilation, vasoconstriction, vasodilation, sympathetic, parasympathetic, sympathetic, parasympathetic, and that's how I'm able to create this good blood pressure, this good pulse. So as I have this increased sympathetic tone, if I have this increased vasoconstriction, what do you think my blood pressure is going to do? Should increase, right? And now I'm able to let off my gas. I'm starting to coast. I'm hitting my brakes. My parasympathetic side is coming in. My vessels start to vasodilate. So what is that going to cause my blood pressure to do? Go down, right? So we have this ebbing and flowing, this balance of vasoconstriction, vasodilation based off my sympathetic and parasympathetic nervous systems. Okay. So if my blood pressure is really low, what should my body do to increase it? Increases heart rate, but also to my vessels, what should it do? Cause that constriction, right? And if my blood pressure is really high, I'm really stressed out, I'm having a stroke, what is my body going to try to do to create that or to drop my blood pressure? Dilate. Okay. So it creates that opening and closing. And imagine it this way. If I have a small hose to this water spigot, should I have good pressure or bad pressure? Now, if I take a fire hose, a 4-inch hose, and attach it to that same water spigot, I'm going to have good pressure or bad pressure? Bad pressure, right? So it's the same thing with our vessels, opening and closing. So we talk about the sympathetic and parasympathetic side, right? That vasoconstriction, that vasodilation. So our microcirculation, this is our blood flowing through our capillaries at that micro side. Our capillaries are those single cell length vessels. What happens in the capillary? Gas exchange, right? So we have transfer of oxygen and nutrients off of the cell, and then what happens to the cell, or what comes onto the cell? Waste products and CO2, right? Gus Bus, second time on the recording, right? No, good job, Gus. So at that microcellular level in the red blood cell, we have that oxygen transferring off, those nutrients transferring off, waste products and CO2 transferring on, and moving forward and out of our system. The capillaries do have a sphincter. The sphincter prevents it from backflowing, right? So if I have this backflow of deoxygenated blood into my oxygenated side, that is a very poor mismatch. So you have these valves or sphincters that allow oxygenated blood to come in one way, and it has to go out as deoxygenated blood the other way. So things that can cause or factors that can change that capillary, that microcirculation, is that sympathetic tone can cause vasoconstriction, that parasympathetic tone can cause vasodilation, or epinephrine, which is that sympathetic tone, can create changes as well, as far as other local factors. So someone who has cold hands can cause that vasoconstriction, which can read those low SpO2. We have hypoxia, which can cause vasoconstriction, our acidosis, and our histamine releases. What type of medical problem releases histamine? What was that? Allergies, right? Allergic reactions or anaphylaxis, where our body's releasing histamine. So all of these things can affect that microcirculation at the capillary level. We talked about this a little earlier too, is if I'm having these issues at the capillary level, I can have increased capillary permeability, meaning that fluid is easily shifting out of those capillaries, causing edema or swelling. So that's why when we have our allergic reaction patients and they look extremely swollen and all over their body, you have increased increased permeability. Therefore, that swelling is happening either locally or systemically. As far as our blood pressure goes, this is our cardiac output times our systemic vascular resistance. So our heart rate times stroke volume times systemic vascular resistance. Our blood pressure is our systolic and our diastolic. An increase in our blood pressure signals the body to decrease our heart rate and maybe dilate the vessels. A decrease in our blood pressure tells the body to increase the heart rate and maybe cause some vasoconstriction, right? So it's this constant balance, this ebb and flow of sympathetic, parasympathetic tone to maintain that cardiac output and that homeostasis. So we have our systolic, our diastolic, and our pulse pressure. What is our systolic measuring? Contraction of the left ventricle. And the diastolic is measuring the relaxation of that left ventricle, and our pulse pressure is the number in between the two. So 120/80, our pulse pressure would be 40. Okay. Our hypertension is considered at 140 systolic or 90 diastolic. So that would be the beginning realm or beginning numbers of our high blood pressure, hypertension. And the higher the blood pressure, the more susceptible to having a vessel burst somewhere. And that's what our strokes are. So we have our baroreceptors and our chemoreceptors. Our baroreceptors measure pressure, right? So think barometer or pressure. These are in our aortic arches and our carotid sinuses. And then our chemoreceptors, they're measuring those chemicals for impulses to either increase or decrease our blood pressure. So my sympathetic and my parasympathetic nervous systems, right? So that sympathetic nervous system is that fight or flight, that epinephrine, norepinephrine being released. As I release my epinephrine, norepinephrine, it stimulates my alpha 1. My alpha 1 is my vasoconstriction, right? So that causes my vasoconstriction. If my vessels are vasoconstricting, what is happening to my blood pressure? It's increasing, okay? As I'm relaxing, my parasympathetic nervous system takes over. It then stimulates my body to cause vasodilation, which then will do what to my blood pressure? Decreases, okay? So our receptors, we have our alpha 1, our alpha 2, our beta 1, and our beta 2. Our alpha 1 receptors causes that vasoconstriction. Our alpha 2 are thought to correlate with our alpha 1s. My beta 1, I have one what? Heart. Beta 1, one heart. So it affects my heart. So it increases my heart rate, increases AV conduction, and increases contractility. Contractility is the strength that my heart is able to pump the blood through my body. And then my beta 2, I have two what? Lungs. So beta 2, two lungs. This stimulates smooth muscle relaxation, and it also stimulates bronchodilation. Okay, so it opens up my lungs to help me breathe a little bit better or easier. Beta 1, one heart. Beta 2, two lungs. So as far as conclusion, we've talked about metabolism, perfusion, EQ mismatch. We've talked about how perfusion works. We've also talked about our hemoglobin, hematocrit, and our blood pressures. Any questions? Yep. All right, guys.